Hello, my name is Ralph Cox and I'm an ADON in the Office of the Chief Nurse and Midwife, and welcome. I'm here today to talk to you about designated RN prescribing, which is undoubtedly a significant change and reform for the nursing profession for some time. What I'm going to talk about today is we'll define what designated RN prescribing is. We'll also talk about some of the governance and regulation that we're putting in place around designated RN prescribing. And then we'll talk about considerations for services who are looking to implement designated RN prescribing. First of all, what is designated RN prescribing? So from the registration standard, a designated registered nurse prescriber is qualified to administer, obtain, possess, prescribe, supply, and or use Schedule 2, 3, 4, and 8 medicines in partnership with an authorised health practitioner and under a prescribing agreement. Importantly, at all times, the registered nurse is responsible and accountable for prescribing within their scope of practice and authorisation. Just to clarify that an authorised health practitioner or prescribing partner is typically a medical practitioner or a nurse practitioner. What are some of the benefits of designated RN prescribing? Well, it's been shown to provide benefits for consumers, for practitioners, and for health systems. So for consumers, it's been shown to be safe and effective and improves access. It expands timely and affordable access to medicines, especially for rural, remote, and vulnerable populations. For practitioners, it increases scope, extends knowledge, and the skills of registered nurses. And for health systems and health services, it's been shown to improve system efficiencies by reducing unnecessary or delayed presentations to other services. We often get asked, what is the difference between designated RN prescribing and nurse practitioners? And this slide attempts to describe that difference. So on the far left, we have registered nurses. Registered nurses obviously have a Bachelor of Nursing or equivalent, but don't have any prescribing endorsement. Their authority to prescribe is limited to medicines agreed through such things as policies and protocols, such as nurse-initiated medicines. On the far right, we have nurse practitioners. So nurse practitioners have a Master of Nurse Practitioner and the equivalent of 3 years full-time experience or 5,000 hours at the clinical advanced nursing practice level prior to endorsement. They have endorsement from the NMBA as a nurse practitioner, and they're able to autonomously diagnose and prescribe scheduled medicines within their scope of practice. And then in the middle, we have the new endorsement of the designated RN prescriber. And a designated RN prescriber has a postgraduate qualification in designated RN prescribing, as well as a minimum of 3 years or 5,000 hours of clinical experience post their initial registration within the past 6 years. They have the endorsement from the NMBA for scheduled medicines, and they're authorised to prescribe only within a clinical governance framework under an active prescribing agreement and in accordance with the state and territory medicines and poisons legislation and regulations. So just to reiterate, designated RN prescribing is prescribing in partnership with an authorised health practitioner, whereas a nurse practitioner is authorised to autonomously diagnose and prescribe scheduled medicines. So what is the pathway to becoming a designated RN prescriber? So initially, you need to have general registration with the NMBA with no conditions or undertakings on your registration that are relevant to the endorsement. As I mentioned, you should have a minimum of 3 years full-time post-registration clinical experience or 5,000 hours within the last 6 years. And we're encouraging any RNs who are interested in undertaking the study to discuss this with their managers in the first place. Ideally, have a discussion with your manager around how will designated RN prescribing work within the service model that you have within your health service, and how will it benefit consumers. The registered nurse then undertakes and completes an NMBA approved program of study or equivalent units, and then apply for endorsement with the NMBA as a designated RN prescriber. Once you're endorsed, you must comply and work within the NMBA standards and guidelines, Tasmanian legislation and regulations, and any organisational policies in relation to prescribing. As I previously mentioned, you'll work within a clinical governance framework and have an active prescribing agreement with an authorised health practitioner, as well as complete a 6-month period of clinical mentorship from the time of your first endorsement. Designated RN prescribers will also need access to various digital platforms for prescribing, such as the real-time prescription monitoring system, and you also need to apply for a PBS prescriber number with Services Australia so that you can prescribe medicines from the Pharmaceutical Benefit Scheme. So this next slide describes the designated RN prescribing practice framework, including the values, principles and systems guiding registered nurse prescribing in the Department of Health. So health services in Tasmania are designed to meet the health needs of the Tasmanian community, and they're underpinned and strengthened by the Department of Health values of compassion, accountability, respect and excellence. And the care delivered is person-centred, it's safe and quality, it's coordinated, and it's delivered by the right person at the right time and in the right place. Now, designated RN prescribing occurs within a clinical governance framework, and there's many elements to that. So at a national level, we have the NMBA registration standard and guidelines for designated RN prescribing. And then at a more local level, a state level, we have the Tasmanian Poisons Act and the Tasmanian Poisons Regulations. At a health service level, we have a statewide policy for designated RN prescribing, and supporting that policy is the prescribing and clinical mentorship agreements. Designated RN prescribers are also required to be credentialed through the Department of Health, defining scope of clinical practice and credentialing processes. And then at a health service level, we have models of care and any medicines and medication policy and governance. And all these elements come together to ensure we deliver best practice prescribing in partnership. So what is the prescribing agreement? Well, the prescribing agreement is a formal written document that describes the roles and responsibilities of the designated RN prescriber and the authorised health practitioner. It defines the scope of practice of the designated RN prescriber and the classes of medicines that they will be authorised to prescribe. It also includes processes for consultation and referral. For example, when care falls outside of the RN scope and there is a need to refer to the authorised health practitioner or another health professional. The prescribing agreement also includes a process for resolving or escalating differences of opinion and a date and plan for regular review. Importantly, the prescribing agreement needs to be signed off by the designated RN prescriber, the authorised health practitioner, and an organisational representative, such as an executive director of nursing and midwifery or their delegate. Next, what is the clinical mentorship agreement? So the clinical mentorship period supports designated RN prescribers to develop experience and confidence in prescribing within their scope of practice for the first 6 months following their initial endorsement. The role of the clinical mentor is to provide the designated RN prescriber with support and guidance to assist in the consolidation of knowledge and skills in relation to the prescribing of scheduled medicines. The mentor must be an authorised health practitioner, so again, a medical practitioner or a nurse practitioner, who can commit to providing respectful and constructive feedback and guidance through a series of scheduled mentorship sessions. The mentorship agreement outlines the framework for mentoring, including defining expectations, boundaries, roles and responsibilities, and communication methods between the designated RN prescriber and the authorised health practitioner. It requires signatures and approvals from the RN prescriber, the authorised health practitioner or mentor, and again, an organisational representative such as an executive director of nursing and midwifery. So next I'd like to talk to you about implementation of designated RN prescribing and what are some of the considerations that services need to think about. Well, first of all, education programs. So there's been quite a lot of variance in programs across the country, and there are several programs which have been approved by the NMBA and are now open for registered nurses to enrol and study in. And we are aware that there are a number of registered nurses at the time of the recording of this presentation who are undertaking study and potentially graduating within the next month or two. So universities are offering courses at grad certificate level, but with varying course requirements. Everything from a 4-month professional certificate at the University of Melbourne to a two-year graduate diploma at the University of Tasmania. And there are a number of other universities that are offering courses at the graduate certificate level. In terms of implementing designated RN prescribing, what do services need to consider? Well, they need to make sure that there is an identified need for designated RN prescribing and that it can be accommodated in the current model of care. You also need to think about and identify potential prescribing partners, so medical practitioners and nurse practitioners who are willing to be party to a prescribing agreement and support a designated RN prescriber, particularly if that designated RN prescriber needs to undertake the 6-month clinical mentorship period. The service also needs to consider cost implications such as PBS access and what that means for consumers. So we are aware at the time of recording of this that the Australian Parliament is considering legislation to allow designated RN prescribers access to prescribing medicines on the Pharmaceutical Benefit Scheme or PBS. And we expect this legislation to be in force by October to late 2026. In terms of implementation, the service needs to consider how will a model of care work that successfully integrates designated RN prescribing into its look and function. And ideally, this will be co-designed with registered nurses and other members of multidisciplinary teams. We also need to consider what communication resources are needed to raise awareness of the role within the multidisciplinary team and other staff members, so that we clearly define the role of the designated RN prescriber and the prescribing partner. So what is the best way to communicate this, not only with other members of the healthcare team, but also with consumers? Because research shows that consumer trust and understanding of nurse prescribing can lead to improved service use, effectiveness, and uptake. It would be useful also to think about how can we build an evaluation from the start to demonstrate the feasibility and impact of the designated RN prescribing role and evaluate the appropriateness of prescribing decisions. Which also leads to how we can effectively undertake audit and review of prescribing practice, not only to fulfill the requirements of the NMBA standards and guidelines, but also to ensure safe and quality prescribing. And the literature repeatedly emphasises the importance of quality champions, people within services who are visible and can provide ongoing information and communications, promoting and coordinating implementation, and ensuring that the clinical governance elements and systems that are needed for designated RN prescribing are in place. So what are some of the timeframes with regards to designated RN prescribing currently? Well, the clinical governance elements within the Department of Health have now been developed and approved by the Tasmanian Health Service Executive. So we've met that May 2026 deadline. We're expecting the first endorsements of designated RN prescribers to come online in June to December 2026 as students finish their studies, graduate, and apply for endorsement with the NMBA. As I mentioned just before, we're expecting PBS access to be available to designated RN prescribers probably from October 2026 towards the end of the year. And as we move into the second half of 2026, the Office of the Chief Nurse and Midwifery Officer will be offering ongoing implementation support to services looking to implement designated RN prescribing. And this will include development of a toolkit of resources and materials to help services decide whether or not designated RN prescribing is something they want to introduce and would it provide benefit for their consumers, and also resources to help with that transition process. What I've spoken to you about today has been quite interesting and informative. But now I'd like to ask you a few questions just to prompt your thinking. Firstly, do you have any questions about what I've spoken about today? If you do, get in touch at the Office of the Chief Nurse and Midwifery Officer, and I'll provide the contact details shortly. I suppose some other questions that you could have a think about is, where do you see designated RN prescribing providing benefits and increasing access to medicines in your services? Where are those bottlenecks in terms of medicines that designated RN prescribing could help remove? Do you see any issues with the model being proposed? If you do, get in touch and let us know. And what challenges do you see in implementing designated RN prescribing in your service? Do you have any medical or nurse practitioners in your service who would be keen to enter into a prescribing agreement? If you're a registered nurse who's interested in becoming a designated RN prescriber, I encourage you to talk with your manager and also talk with any medical practitioners or nurse practitioners in your service who you think would be interested in being your prescribing partner. In addition, what supports, materials and resources would you need to support the implementation of designated RN prescribing in your service? If you have any ideas, don't hesitate to get in touch with us. And in order to get in touch with us, please use the email address on the screen, the phone number, and if you're after any more information on designated RN prescribing, you can always access that through our public-facing webpage. And if you scan the QR code on the screen at the moment, that'll take you straight to it. If you have any trouble finding it, just go into the Department of Health public-facing webpage and put into the search bar designated RN prescribing. Well, I hope today's been informative. And if you have any further questions or queries, don't hesitate to get in touch with us, especially if you are a service that's looking to implement designated RN prescribing. Thank you.